Hello, students. Welcome to Next Level Academy. Step up your career. Today, we are going to see questions which are asked in.
First question was asked is fatality rate. What's called the fatality rate? Fatality rate is nothing but number of the death due to the disease by number of cases of disease into 100. This is the formula. I'll tell you in an easy method. For example, let's take COVID. Suppose 1 lakh cases has been diagnosed. In this 1 lakh cases, suppose 1000 cases are dead after giving the treatment. So 1000 divided by 1 lakh into 100. So this is what you have to understand. So what does it mean actually? It reflects the fatal outcome of the disease by affected efficacy of the treatment, which means after diagnosing 1 lakh cases, they have given treatment. After giving the treatment, 1000 cases are dead. So this shows how much effective is the treatment is. We'll go to the next.
Heparin drip calculation. So, the question is a doctor ordered to start a heparin drip for a patient with 18 units per kg per hour, and the weight of the patient is 75 kg, and we need to calculate the rate of infusion. So, here, first step is we will identify the total units to be given per hour. So, we will multiply 18 to 75, and we will get 1350 units per hour to be administered. So the desired amount to be administered is 1350, and to make heparin drip we use 500 ml of saline, normal saline. So what we will do, we will keep 495 ml of saline and add 5 ml of heparin in it to make the drip. Okay, so the total quantity will be 500 ml. Understood, students? And we have taken 5 ml of heparin, means how much units we have taken? 5 ml, uh, 1 ml of heparin contains 5000 units. So 5 ml will contains 25,000 units. Okay. Now the available amount is what? 25,000 units. Okay. So now we will calculate D upon A into Q. D is 1350, available is 25,000, 25,000 into what is the total, what is the quantity? 500 ml, because we have made the whole drip in 500 ml saline, right? Okay. Now infusion rate. How will we calculate? We will solve this, and we will get 27 units per hour. Clear? You may think that how can we calculate it by using this simple formula? Because here we have all the thing, and we just need we need to find out the ml. Matlab we have 500 ml, and how much ml per hour we need to give. So apply simple tricks and you will able to solve the questions. Okay, just concentrate on the things you have given and you will be able to solve the question easily.
Next is infant phototherapy care. This is an important procedure which was asked in JIPMER 2023 skill test. First, you have to check whether the phototherapy light is properly functioning or not. Second, no clothes or any other objects kept on the phototherapy machine. Next, for to start any procedure, it's a universal thumb rule that is the nurse or the medical professional has to go for hand washing. If you are not aware with the hand washing procedure steps, you can go to our previous videos and you can watch it. You have to keep the phototherapy infant bed clean, the cradle. Now, after washing the hands, you have to keep the baby. While keeping the baby, you have to be very, very conscious that the baby's diaper is properly provided or not. The groin part should not be exposed and the eye also should be covered. See to that the iPad is not blocking the nostril of the baby. At intervals, the baby can be fed because during the phototherapy, the baby can go for dehydration. After that, the baby is fed properly and it has to be tapped at the back for burping. And then, while keeping the baby back to the phototherapy machine, it has to be kept on the sideline position, which means the position has to be changed. So these are the important things. And I forgot to tell you something. And you have to check for the temperature of the baby because because of the phototherapy, the baby gets the temperature increased. And at intervals, by the doctor's order, the bilirubin level has to be checked. As you know, the purpose of the phototherapy is to reduce the is a treatment for jaundice. Okay, we'll go to the next.
Next is intestinal clamp. These forceps are available in straight and in curved form. And inside of it, you can see these lines which help to form a grip while holding the organ. And it is used to hold intestines and intestinal walls because these are non-traumatic. So you can hold the organs without any trauma to them. Next is Babcock forceps. Uh, how to identify it? You can see that the tip of this forceps is like a ring. It forms a finger ring. So you can easily identify it by seeing the tip of it, and it is non-perforating forceps, and because of this, it is used to grasp delicate tissues, delicate tissues like fallopian tubes. Okay. Next is uterine sound. You can see that it has markings over here. So uterine sound, the name itself suggests that it is used to measure the length of uterine cavity, like while doing several procedures like copper insertion, marina insertion, they measure the length of uterus and accordingly they insert the marina or the copper T. Okay. Next is bladder sound. This is more or less same as uterine sound, but it is slightly thick than the uterine sound. And the second difference is it does not have markings over it, and it is used to find any stones in the bladder. Okay. And uh, also in vaginal hysterectomies, sometimes the surgeons may rupture the bladder. So to see that whether it is intact or not, they insert this instrument to see whether it is coming out or not from the next stand. Okay. Next is speculum. You can see that it is C shape, and it is used to retract the posterior wall of the vagina. Next is Wrigley outlet forceps. It is used to deliver the baby, and sometimes it is used in cesarean section. Otherwise, in whenever the head of the baby is struck while coming out, we will use these forceps. And it has parts like these are blades, and these are shanks, and these are the handle or stem, and here the lock, because it has two parts, like one is left and one is right. We always check it that whether it is properly locked or not. So first we insert one side of the forceps, and then we insert the second one and lock it, and here we will try to pull the baby out by holding the baby's head in inside this um inside this cavity. Okay.
Next is non-rebreather mask, which means colloquially we say NRBM. So this mask and the other mask, what is the difference? Okay, let's see. So this mask has four main parts. First is the mask, second one is the reservoir bag, and third one is the oxygen port where we allow the oxygen through the cylinder through this way. And the fourth one is the exit valve. So this mask, it holds the oxygen through the oxygen cylinder, holds the oxygen at a large capacity, and it will allow it through the patient through the mask. When the patient exit exhales the carbon dioxide, this will let out through this exit valve. It's a one way so that the carbon dioxide will not enter again. So when the patient oxygen saturation gets low, say like beyond beyond 80 percentage, so this NRBM mask is encouraged to provide.
Next is corrugated open surgical drain. This tube is made up of rubber material, and it has multiple tubes like structure in it, and the end of this surgical drain has zigzag like of structure, you can see, with which facilitate passive drainage. We call it open drain, and it passively drain the fluid from the wound, and it is fixed near the wound with the help of suture material. It is used for wound drainage and also deep drainage. If you like this video, then please like, subscribe, and share. All the best for your upcoming skill test. Thank you, students.